Last point I want to discuss today is about autism spectrum, and this is a very important concern that many parents have when they have toddlers. It's very important to know that this is a spectrum. So it's something related to the way the brain neurotransmitters control, and it's partly genetic and partly environment related. So if you have a genetic makeup and you have the setting to provoke it, the child may manifest it. Typically, they start manifesting by 1.5 to 3 years. Some babies, you can pick it up even at 1 year to 1.5 years of age. And the older they get, the easier or more definitive the diagnosis is. Because it's a spectrum, there is a range of concerns. So not every child will be severely autistic. There are children who have interaction problems, they have problems with empathy, they may not feel emotions, but the more severe ones have significant language delay. They don't interact, they usually interact with objects more than people. So if a child has delayed speech and during the first year they're not having much eye contact, they're not smiling in response to the family, they're not looking at where the parent is pointing, they're not trying to get the parent's attention to show things which engage them by 1 year or so. If by 15 to 18 months the child doesn't even say one word, it's worrying. If by 20 to 24 months they're not joining two words, it's a concern. If they don't have eye contact, if they don't listen to you consistently, I mean, children can be distracted, they may not listen to you when they are busy playing with something. And if it is consistently the problem, then you have to think of autistic spectrum. You have the MChat, which you can Google it up, and the American Academy endorses it. This is a 20-question questionnaire for infants between 16 months and 30 months. You can fill in the scores, and then based on that, it will give you a feedback as to what the risk is. If the risk comes high, you have to discuss with your pediatrician or even a pediatric neurologist or a child development center on further takes. So the children with autism have less interaction with the person. They don't understand mutual interaction. The language development is delayed as a reason. Excessive screen time often produces a child behaving the same way. So it is quite confusing. And how to approach a child with suspected autism? The pediatrician basically assesses the questions and concerns you have. And then if they do feel seriously that it could be in the autistic spectrum, they will refer you for a hearing assessment to make sure that's not the reason for the language delay. If the hearing assessment is already normal, you have to go to a child psychologist who can do a more extended tool to assess the child's development as well as the aspects of autism, whether they fulfill or not. And it's a multidisciplinary approach. If the child falls in the autism spectrum, they need additional support. You need to evaluate more with a speech therapist. We do have behavioral therapist and child psychologist working along with the developmental pediatrician. If you intervene early, the outcome is fairly good. So one of the key messages here is that because screen time can provide some confusion with that, and also it has an impact on their future development and learning, be careful with avoiding screen time when they're young. Totally avoid screen time as best as you can till 18 months of age, and beyond that, limit the screen time. Now for the older kids with the online schooling, it becomes difficult to totally limit it, so you minimize it as best as you can. Second point is, if you have a concern, raise it with your pediatrician. Don't delay. There are a few features that may mimic. I told you about the eye contact. I told you about the language delay. There is something called stereotypy, where they like to do the same task repeatedly. The autistic children do not like a change in their routine. So if you don't give their breakfast on time, for example, or you change the type of breakfast, they totally refuse it. Of course, all children do this to some extent. Stacking cars and toys repeatedly in the same pattern can be concerning as well. Lack of empathy, so they don't recognize the pain that others go through. Not showing emotion, not showing keenness to involve others in what they enjoy. Being focused more on objects more than people. So all these, they may not play well with peers, they try to keep aloof and so on. So all these are important factors that make you think about it, and don't delay, because if there is a delay, obviously the management approach can be different. Most of the management is behavioral modification. We change the way we respond to the child, so we understand the child, what the defect is, how to approach the problem, and then it gets better with time. If you have a new sibling, there is a sequence called sibling rivalry. And this can typically happen when you have the older child between 1.5 to 3.5 years or so. As a child gets older than that, they don't feel too much of rivalry, and it's easier to make them understand to engage better in the care of the younger sibling as well. Actually, the 18-month-old or a 2-year-old may not even realize that they have a sibling, and they do lead a fairly independent approach. So, involve the child during the pregnancy, start talking to them about the new baby that is coming, and understand that they may not understand that it's a sibling that's coming. When the baby is there, they may consider the baby as a toy, so be careful how they handle it. At the same time, don't shout at the baby, don't shout at the child. If they do commit some mistake, be gentle, take them away, and try to make them part of the team. So involve them in the care of the baby, bring the nappies, praise them a lot. Praise works wonders, but negative feedback doesn't do good. So shouting, you always stay in control. Again, going back to the question of discipline, you stay in control, you don't shout at the child, and you try to do your best engaging them. Of course, the mother is tired, the father is tired. If the grandparents are there, you're lucky, and so engage them as best as you can, and support them during this period. Vaccination in the 2 to 3 year period, obviously we are coming on to the second stage when you talk about the optional vaccines more during this phase. The first 15 to 18 months we have the government scheduled vaccines, and we have the vaccines at 15 months and the 18-month stage, which are also covered in the government schedule. The optional vaccines we discuss are often hepatitis A vaccine, meningococcal vaccine, and typhoid vaccine, and the seasonal flu vaccine. So be aware that these vaccines are due during this period. After this is completed, the next vaccines usually come when they are around 4 to 6 years of age. So discuss with your pediatrician regarding the pros and cons of taking the optional vaccines. We do recommend them, but which vaccine you take at what age, how many doses, so this will need to be clarified with your individual physician.